Good evening, everyone. I want to first off say thank you for everyone coming to our CHA and CHIP presentation tonight. I'm Nikki Anjeski, the Public Health Director. We're really excited to be going over our community health assessment with you, some of the data that we found, and also our CHIP goals, objectives, what we have planned for the next 3 years, not only with ourselves, but with all our partners. So we're really excited that you guys could join us tonight. Just so everyone knows, this presentation will be recorded and we will be posting this on our website. I'm going to introduce Hannah Commons. She's going to be our moderator for tonight. Hannah is one of our public health fellows here at the Cortland County Health Department. Her focus for the fellowship is in health communications. So in this role, she is responsible for updating our organizational branding strategy and aiding in content creation for the social media sites that we hold. Hannah graduated from SUNY Oswego in August 2021 with a bachelor's degree in wellness management. So once again, thank you everyone for coming, and I will hand it over to Hannah.
Welcome, and thanks again for coming. I would like to go over a few things before we begin. Firstly, as Nikki stated, this meeting will be recorded. We will email the recording to all of you and post it on the Health Department Facebook page to be shared with other community members who are unable to attend. Secondly, we ask that you would please put all questions in the chat. At the end of each section of the presentation, we will be able to answer a couple of questions. Answers to questions related to the community health assessment and the Community Health Improvement Plan that we are not able to answer tonight will be sent out to registrants and also posted on the Health Department website. Lastly, anyone using the chat feature to promote hate speech, discrimination, obscenities, defamation of a person or people, name calling or personal attacks, sexual content, or comments related to county personnel will be immediately removed from the Zoom. Now, I would like to introduce our first speaker, Margaret Broderick. Margaret has been the epidemiology manager at the Cortland County Health Department since October 2021. In this role, she is responsible for leading the community health assessment and the Community Health Improvement Plan process, strategic planning, public health accreditation, and other data and communications related projects. Prior to that, she was the epidemiologist at CACTC and managed the yearly Cortland County Youth Survey. Margaret graduated with a Master of Public Health degree from SUNY Albany and is certified in public health by the National Board of Public Health Examiners. She received a BS in biology from SUNY Geneseo.
Thank you, Hannah. So welcome again, everyone, and thank you for coming. So first, I just want to give you a brief overview of what the Community Health Assessment and Community Health Improvement Plan are. First of all, you'll hear myself and others today refer to it as the CHA-CHIP, so just keep that in mind when you're listening to speakers today. So every 3 years, the New York State Department of Health requires health departments and hospitals to complete a community health assessment and create a community health improvement plan, which is in alignment with the New York State prevention agenda. So this year we partnered with Guthrie Cortland Medical Center to undergo this process collaboratively. And just to distinguish between the two, the community health assessment presents and analyzes demographic, primary, and secondary health and social determinant of health data to identify health challenges of Cortland County community members. And the CHA also assists with identifications of health disparities, determining gaps in healthcare access, and assessing resources. And then the Community Health Improvement Plan then outlines the actual interventions that will be implemented in the community to address the health focus areas and goals that are identified through the community health assessment process. The CHIP is designed to ensure accountability in addressing the needs of the community and includes quarterly progress assessments. So if you marked that you want updates on the CHIP when you registered for this presentation, you'll be added to that list and we'll start receiving those updates in the spring of 2023. So today, I'll be presenting the data that was considered when selecting the 3 focus areas and 7 community health goals for Cortland County for 2022 to 2024. And following my presentation, we'll have speakers from different agencies that will discuss interventions related to the Community Health Improvement Plan that their coalition or organizations are and will be implementing related to the focus areas that were selected. So for the sake of time, I'll only be sharing data related to the focus areas that were selected for the CHIP. So those were opioid and other substance use and death, suicide prevention, tobacco use, and COVID-19 and flu vaccination. But I do encourage you all to review the full report, which outlines data for all 13 of the New York State Prevention Agenda focus areas that were considered for selection, and also has detailed methods on data collection that I can't go into detail on for the sake of time. Same sentiment for the Community Health Improvement Plan. We just have a snapshot of our partners tonight. So if you're interested in looking at all of the interventions for that plan, you can go ahead and look at the full report or go to the dashboard. So the first type of data that we looked at when assessing the New York State Prevention Agenda focus areas was secondary data. So that's data such as rates per 100,000 population from state data sets and dashboards. And the state data is a good source to look at because it can be applied to our whole population and provides historical and geographic comparisons to really benchmark our community against other communities. But the data sources from the state, the secondary data sources, does have limitations. It's years behind oftentimes. So a lot of the secondary data I'm going to be showing is from 2019 or earlier. And the state doesn't really break the data down by specific demographics. So we're unable to identify disparities that we should be focusing on. So that's why we also collect more recent primary data in the form of the Community Health Assessment Survey, which I'll be talking about a little bit later. So on the CHIP dashboard, secondary data for all the New York State Prevention Agenda focus areas we looked at can be found under the 4 drop-downs under Community Health Assessment, the first 4 drop-downs. So health status, healthcare access, health outcomes, and health risk and protective factors. Looking at health outcomes for the focus areas that were eventually selected by the steering committee, in 2019, Cortland County did fare worse than New York State in all 5 behavioral health outcome indicators we reviewed, which included the age-adjusted rates per 100,000 for all emergency department visits involving any drug overdose. Cortland County was 285.3. Per 100,000 compared to New York State's 178.8 per 100,000. All emergency department visits involving any opioid overdose, which was 108.6 compared to 53.1 per 100,000. Overdose deaths involving any drug, which was 27.6 per 100,000 compared to 18.3 per 100,000 for New York State. And overdose deaths involving any opioid, which was 22.9 per 100,000 compared to 14.9 per 100,000 in New York State. In 2017 to 2019, Cortland County also fared worse than New York State for age-adjusted suicide mortality rate per 100,000, which was 10.7 per 100,000 compared to 8.2 per 100,000 in New York State. Tobacco was the second, another focus area selected by the steering committee for 2022 to 2024. When we look at health, one of the health outcomes related to tobacco use, such as lung and bronchus cancer incidence rate and mortality rates per 100,000, in 2015 to 2019, the incidence rate of lung and bronchus cancer per 100,000 in Cortland County was higher than New York State, 86.9 compared to 56 per 100,000 in New York State. And New York State also experienced a decrease in lung and bronchus cancer incidence from 2010 to 2014 to 2015 to 2019, while Cortland County actually experienced an increase during this time frame. In 2015 to 2019, the mortality rate per 100,000 of lung and bronchus cancer in Cortland County was higher than New York State, 47.1 per 100,000 compared to 31.4 per 100,000. Additionally, when we look at health risk and protective factors related to chronic disease or related to tobacco use, the percentage of adults who reported smoking cigarettes is higher in 2018 for Cortland County than New York State, 19.8% compared to 12.8%. For the flu, for the COVID-19 and flu focus area, so the vaccine preventable disease focus area under the New York State prevention agenda, we really looked at vaccination rates and vaccine disparities in the community for our secondary data. So really the protective factors for these two communicable disease. Looking at data from the New York State Immunization Information System, only 34.4% of Cortland County residents got a flu shot in 2021 to 2022 flu season. The New York State Immunization Information System also allows us to look at this data by demographics, which shows that residents living in the areas of Willett and Truxtun are less likely to be vaccinated. And similar geographic disparities exist for COVID-19 vaccination, with Willett and Truxtun residents being the least likely in the county to be fully vaccinated. In general, Cortland County lags behind the state in COVID-19 vaccination. At the time of the community health assessment in May 2022, only 62.7% of Cortland County residents ages 5 and older were vaccinated, compared to 81.7% of New York State residents. The second type of data we looked at when assessing the New York State prevention agenda focus areas was primary data that we collected with the Community Health Assessment Survey. So this is the exciting new data that probably a lot of you are here to hear about. So this survey was conducted in February and March of 2022. And with the help of all of our partners, we were able to collect 2,266 surveys from Cortland County community members. And the questions on the survey assessed the behavioral health and chronic disease related health factors of survey respondents, as well as asked community members what their top 3 most important health related problems are, top 3 unmet healthcare needs, and top 3 unmet non-healthcare needs or social determinants of health. And I just want to emphasize here too, involving community members and community engagement in identifying health needs will ideally create a stronger bond between public health and the community, which can lead to improved communication, community member collaboration on projects, and mutual respect. So we hope by doing this survey and allowing community members to participate and voice their opinions, will assist with facilitating shared ownership and involvement in the improvement plan as well through the various coalitions and projects that are identified. Before I get into the primary data from the Community Health Assessment Survey, I do want to mention, just like the state data, the secondary data I just spoke about has limitations, like it's outdated, so does the primary data that I'm about to share. So the Community Health Assessment Survey only provides a point-in-time snapshot of health in Cortland County based on the responses of the people who took the survey. So we can't say the survey is representative of the whole population, but it did provide us with a direction related to health disparities that may exist in the community, and also, as mentioned, perceptions of community members on different health topics. So both of the data sets we looked at have limitations, which is exactly why we look at multiple different data sources and types of data when making decisions for the Community Health Improvement Plan. I also just want to make a note on the health disparity data that I'm going to be presenting. So health disparities don't exist because of individual actions or the fault of the individual groups. It's really from systemic issues related to discrimination and exclusion that create health disparities. So just keep that in mind when I'm presenting the health disparity data here as well. So to get an estimate of the percentage of the survey population that was at risk for a substance use disorder, we incorporated questions into the Community Health Assessment Survey from the clinically validated CAGE AIDS screening tool. So using this tool, 23.8% of CHA survey respondents were considered at risk of substance use disorder. And again, we were able to look at disparities in substance use disorder based on the self-reported demographics of survey respondents. So the two largest disparities identified in the Community Health Assessment Survey population were based on gender identity and ethnicity. Self-identified transgender plus and self-identified male respondents were more likely to be at risk of a substance use disorder than self-reported female respondents. And self-identified Hispanic Latino survey respondents were more likely to be at risk of a substance use disorder than non-Hispanic, not Hispanic Latino respondents. We also included in the survey a choose all that apply question that asked respondents about their personal experiences related to suicide. So there was many different respondents or responses they could choose from, but for the purposes of this presentation, I'm just going to share the survey respondents that reported attempting suicide in their lifetime. So a total of 6.4% of survey respondents reported attempting suicide in their lifetime. However, when we look at the demographic groups, again, disparities do exist based on the survey data, with young people 18 to 24 years old being more likely to report attempting suicide than older adults, and self-identified transgender plus respondents were more likely to report suicide than self-identified female or male respondents. Additionally, respondents with a self-reported disability were also more likely than people without a self-reported disability in the survey respondents to report attempting suicide in their lifetime. When we look at community member perceptions on health-related needs, alcohol and substance use and mental health problems were the top two most selected health-related problem by survey respondents in 2019, and important health-related problem, that's the word I forgot, were the most selected important health-related problem in 2019 and 2022. And mental health and substance use, rehab, counseling, and prevention were selected as the top two most selected unmet healthcare needs by community member survey respondents in 2019 and 2022. So looking at the next focus area, tobacco, 13.7% of survey respondents reported tobacco use in the past week. And similar to the other indicators, disparities in tobacco use were prevalent by different demographic groups. So the largest disparity in the Community Health Assessment Survey data for tobacco use was observed in education level, with reported tobacco use in the past week increasing with self-reported level of education. So 25% of respondents with less than high school diploma reported using tobacco in the past week. I also do want to mention just some youth survey data here because it was factored into decision-making for this focus area. Youth survey data isn't included on the dashboard, but is in the full report and on CACTC's website. The percentage of 7th through 12th graders in Cortland County that reported vaping in the past 30 days increased from 13.9% in 2020 to 14.5% in 2021, and outpaced alcohol for the most reported substance use behavior by Cortland County youth in 2021. And also, 2021 was the first year since 2017 to 2018 that there was an observed increase in youth vaping in Cortland County. So I just did want to mention that data as well. And while the dashboard only shows the top three most selected responses for important health-related problems, I do want to mention that cancer was the 5th most selected response for that question, and tobacco use was the 9th most selected response out of 20 possible options. Additionally, the education level with the highest percentage of respondents reporting cigarette use, less than high school diploma, had cancer as the third most selected health-related problem, and that did differ from the total population, so that was interesting as well. For COVID and flu focus area, there was one question on the community health assessment survey related to COVID-19 preventative measures, but since we do have strong current secondary data related to COVID and flu vaccination, I'm not reporting it here and I didn't put it on the dashboard, but if you are interested in seeing that, I can definitely send that to you personally. And while it wasn't in the top 3 most selected responses for important health-related problems by community members, it was selected as the 6th most selected response by community members. And for the age group, the adult age group that is least likely to be vaccinated, 18 to 24-year-olds, COVID-19 jumped up to the 3rd most selected health-related problem. So that's kind of an overview of the primary and secondary data we looked at. The final step of the community health assessment process was getting input from our partners. So the organizations that would actually be implementing the strategies in the community health improvement plan and working towards our shared goals. So we solicited input from partners through a key stakeholder presentation and health prioritization survey. So the first step in that process was presenting a group of stakeholders with local secondary and primary data, so the data that I just shared above, but they received the data for all 13 New York State Department of Health prevention agenda focus areas and goals that were up for selection for 2021 to 2022. This step in the process was to make sure our partners were informed and had data available before completing the key stakeholder health prioritization survey. The next step in the process was each organization involved was provided the survey and asked to complete one survey for their organization, rating each focus area on a scale of from 1 to 5 on each of the 4 criteria the steering committee felt were most important to consider when selecting the community health focus areas and goals. So these criteria were the size of the problem, so the number or percentage of people affected in Cortland County, the seriousness of the problem, so the potential of health problems to result in severe disability or death, the severity of health equity, so the severity of health disparities identified in Cortland County and the likelihood that interventions would address disparities. Resource availability, so the amount of resources available, funding, grants, donations, time, space, volunteers, expertise currently or potentially available in Cortland County. So again, each organization was provided a survey that they would rate each of those, each of the focus areas based on those 4 criteria. We did encourage organizations to consult with the data they were presented from the community health assessment and to use their own personal experience and expertise in the field to complete the survey. And they were also encouraged to consult with other leaders in their organization to create a sense of community and organizational buy-in for the community health improvement plan. So a total of 20 organizations across different sectors completed the prioritization survey, and 80% of those organizations reported they consulted with other leaders. So responses from each organization were weighted equally, and total scores for each focus area were calculated from all the responses. For each focus area and each criteria, they were summed to create the focus area scores for each criteria. So the seriousness score, the resource score, the size of the problem score, and the equity score. And then to determine the focus area's total score, all of the criteria scores were summed. And then based on the total score for each criteria, the focus areas were ranked. And now that I'm saying this out loud to all of you, you might just want to go read the report to look at the methods of how that was done. I felt like I was going on a little bit there. But basically, we looked at those 4 different criteria. Each organization put their input in, and then the 13 focus areas were ranked. So the following focus areas were the top 5 ranked focus areas based on the summed organizational scores. Number 1 was opioids and other substance use. Number 2 was suicide. 3 was depression and well-being. 4 was vaccine preventable disease, and number 5 was tobacco use. So following the key stakeholder survey, the health department and the Guthrie Steering Committee met and took into account all the different sources of data, the secondary data, the primary data with the community health assessment survey and community member input, and the key stakeholder survey to select the final focus areas and goals for the 2022 to 2024 Community Health Improvement Plan. So those focus areas and goals were mental health and substance use disorder prevention, with preventing opioid and other substance misuse and death, and preventing suicide as the 2 goals under that focus area. The second focus area was under chronic disease priority, preventing tobacco use, with preventing initiation of tobacco use and youth vaping, promoting tobacco use cessation, and eliminating secondhand smoke as the 3 goals under that focus area. And then vaccine preventable disease with improving COVID-19 and flu vaccination rates and reducing COVID-19 and flu vaccination coverage disparities as the 2 goals. So now I can answer some questions if there are any, and I'm excited to hear from all of our partners that are here tonight about the interventions they'll be implementing for the Community Health Improvement Plan.
Okay, just as Margaret said, we're transitioning into our segment where you can ask questions. If you have questions for any of the information that Margaret presented on, please put them in the chat and I can read them off to Margaret.
If there aren't any in the chat right now, Hannah, we can move on, and people can put them in the chat as we go along.
Okay, sounds good. Thank you, Margaret, for presenting. We will now hear from 3 coalition and agency representatives working on the Community Health Improvement Plan focus areas of preventing opioid and other substance use and deaths and preventing suicide. There are over 24 partner organizations identified in the Community Health Improvement working on these focus areas. The presenters today will touch on just a few of the interventions, but I encourage you to take a look at the CHA/CHIP dashboard for more details on all of the interventions. First, we have Carly Nichols. Carly is the program manager for community and hospital-based projects at the Guthrie Clinic. In this role, she supports the community health needs assessments at the 4 hospitals in the Guthrie system, as well as overseeing SARE House of Hope and other community-based initiatives within the Guthrie system. Carly has a background in social work and public health and previously worked as a social worker for Guthrie, supporting the home care and oncology departments. Hold on one moment.
Thanks, Hannah. So Guthrie has 4 interventions focused on addressing the goal of preventing opioid and other substance use disorders. The hospital is registered as a New York State opioid overdose prevention program, which allows us to provide Narcan to patients who are at risk of an overdose free of charge when they're being discharged from the hospital. So Narcan is a medication that can quickly reverse an opioid overdose. And our efforts previously have been focused on patients in the emergency department, but we plan to expand and develop workflows to cover patients that are inpatient or behavioral health unit patients. The hospital also has a permanent drug disposal site in the Guthrie Cortland Medical Center emergency department waiting room. So this is a place where community members can safely dispose of unused prescription medications so that they aren't used for other purposes beyond what they were prescribed for. This is accessible to the community members 24/7 because it's in the ED waiting room. We continue to build support systems to care for people who use substances and those at risk of an overdose. So this includes things like we've built into our medical record system a reminder for providers when they're talking to patients about that Narcan, that they can make a referral to family counseling services so that people can access resources for substance use disorder. The hospital is also participating in the Healing Communities study. That's a National Institute of Health study moving into the intervention phase in Cortland. And so we're looking forward to collaborating with partners to bolster workflows and increase the services that are available. We're also partnering with the Alcohol and Drug Council of Tompkins County to provide training for hospital staff in SBIRT, which is Screening, Brief Intervention, and Referral to Treatment. SBIRT is an evidence-based intervention which helps in identifying patients that are using alcohol or other drugs and preventing health consequences from that use. And then switching to some implementation plans around preventing suicide. Guthrie has proposed a $5.2 million renovation to the emergency department and behavioral health unit. And these plans would include a redesign and expanding the footprint of the behavioral health area, and then designating specific behavioral health rooms in the emergency department, and tailoring some of those rooms to youth that might be in the emergency department awaiting behavioral health services. These plans are going to be submitted to the Department of Health, and the hospital can share more details once those plans are approved. Guthrie Medical Group is also actively recruiting telepsych providers across the system, and specifically one that will be focused on the northeast footprint of Guthrie. And so these services will be available to patients in Cortland. And so, Guthrie has a strong telemedicine program, and this will really help increase access to mental health care providers as well for patients in Cortland. And then in the emergency department, they're working to implement an evidence-based safety planning method called the Stanley Brown safety planning method. This provides someone who's experiencing a crisis with specific sets of coping skills or resources when they're to be able to prevent suicidal behavior in the future. And the New York State Prevention Agenda identifies preventing suicide by screening and providing resources for things that might put people at risk for suicidal behavior, like financial strain or housing instability. So Guthrie Medical Group is screening for social determinants of health, which include things like financial strain and housing stability, as well as food insecurity, social connections, and transportation. So these screenings are happening yearly, and then patients are referred to community-based resources to make sure those needs are met. Thank you.
Thank you, Carly. Next, we have Hale Cutter. Hale Cutter completed his bachelor's degree in community health locally at SUNY Cortland. It was through his degree's internship that he was connected with the Speak Up Suicide Prevention Coalition. He has since returned as a public health fellow with the health department and serves as a co-chair for the coalition, helping to develop partnerships that will further suicide prevention efforts in the community.
All right, thank you for that introduction. Hello, everyone. I am Hale Cutter, and I co-chair the Speak Up Cortland Suicide Prevention Coalition. Let's start this. So the Speak Up Cortland Suicide Prevention Coalition is a volunteer coalition of local agencies and organizations, all working to empower our community to eliminate suicide. Just as a quick shout out, September is Suicide Prevention Awareness Month. So you can all follow Speak Up Cortland on Facebook, and you can learn all about the way that we'll be engaging with the community and building up that suicide prevention. So now let's talk about Cortland County's goals for suicide prevention. Obviously, suicide is a very difficult topic. It has a tendency to make people really clam up, but suicide prevention is a really positive force, and it brings the community together. We can learn how to catch the warning signs in our friends, family, and the people around us even. We can learn how to talk to them and get them the help that they need, because an awkward conversation is always better than a final conversation. So suicide prevention starts with education and knowing when to call for help. Next, we have strengthening our community's ability to respond to these calls for help. And finally, we need to do everything we can to limit the access to lethal means of suicide. A suicide crisis can come on very rapidly before any interventions can be made, but every second someone spends looking for a way to take their own life is another second for them to reconsider. So for our first education of the community, we have Gatekeeper Trainings. These are a couple different trainings that help people who interact with many others. This could be, our example is baristas, people who are constantly seeing people, and you can kind of pick up on and recognize some risk factors, and all they need to be able to do is say, hey, here's a card. We have connecting you to Speak Up, and that'll connect you with any other resources that they may need help. Our next education piece is the crisis intervention training. This is for the city police and the sheriff's department. It teaches ways to respond to mental health calls and teaches de-escalation skills for these very difficult calls. And our last one is the implementation of social emotional learning styles. This is teaching our children to manage their emotions and build empathy. These help them to just kind of build these behaviors early on, and that way they never feel like they need to get to a point where they may be having a mental health crisis. So for schools, we have the good behavior game, and then for parents, through the Cortland Prevention Resources, we have positive parenting and parenting wisely programs. So we already touched on improving mental health services, so we'll just do a quick review on that. They are planning to combine primary care with behavioral health care. This is especially for youths who are going in for their annual physicals, and we'll be starting to include that behavioral component to that, not just your physical health, but how they are mentally, socially. We have the safety planning when leaving the hospital. This is instead of just kind of being discharged and left to your own devices, then this is making an organized plan for that person to have. And then we have expanding telehealth services, which that's just helping to bridge that gap. If you can't make your way to a hospital or any other service like that, maybe we can reach you and overcome that barrier. Finally, we have reducing access to lethal means. This means putting time and distance during a crisis between a person and a means of ending their life. In Speak Up Cortland, we have a lot of really pushing out gun locks. They are available at Cortland PD, at the mental health department. I think the county clerk also has them. Pretty much, if you go into a government building, you'll be able to somehow be connected to these totally free gun locks. We also encourage blister packaging for prescriptions. This is like, say, you have opioids and someone may be thinking of trying to intentionally overdose. All that time, extra time of them kind of punching out those pills is, like I said earlier, those extra seconds for them to reconsider. And we also have community drug take-back events for excess medicine. And that is another means of limiting access to intentional overdoses. So you can open this up for questions. You can also contact Speak Up Cortland through this email account. You can find us on Facebook, and soon we will be launching our website as well, as another part of the goal in preventing suicides. We also will be promoting the 988 Suicide and Crisis Lifeline that is being pushed out now. It's going to be nationwide, and it will connect any person in a crisis to the relevant call lines and resources. And
Thank you, Hale. Thank you. Next, we have Valerie Partridge. Valerie has been a peer specialist with Catholic Charities since April 2021. She was recently promoted to the Peer Services Program Manager earlier this month. Valerie has her peer certifications through OMH and OASAS and is part of working with Healing Cortland on the Opioid Task Force and the Lived Experience Group. She also does work with a recently formed recovery community organization.
Hi, thank you. So yes, I'm the program manager at the Wellness Center with Catholic Charities. At the Wellness Center, our primary focus is on mental health, as we're an OMH program. We do also provide some services around overdose and suicide prevention, and that we provide Narcan trainings and some education around opioid usage. We also assess suicide risk and will connect individuals to the appropriate services depending on their risk level. The Wishing Wellness Center is a peer services program that offers a welcoming community for adults struggling with mental illness or co-occurring mental illness and substance use disorder. We strive to provide a safe space where individuals receive respect, encouragement, and hope to strengthen and maintain their recovery. Our staff all go through a process to become an OMH certified peer specialist with regular training and supervision to continue with their professional development and to be able to better assist our consumers. Peer staff also bring with them their own personal stories of lived experience with either mental illness or substance use disorder. We utilize our various stages of our own recovery path to assist others with achieving their own recovery. Staff is adept in navigating resources in the community and connecting people with the services that they need. We support individuals to pursue a successful recovery path by helping them overcome barriers that have prevented them from moving forward. We promote personal recovery through education, socialization, and peer advocacy while sharing our lived experience, self-discovery, and overall wellness. Some services we provide are life skill building. Peer staff will work with individuals on specific skills to help them live a healthier and independent life. Some of these skills can include budgeting, organization, making to-do lists, scheduling appointments, and keeping a calendar. We provide peer support through many avenues, such as being there to listen when needing someone to talk to, going along to appointments for emotional support, providing warm handoffs to other service providers, prioritizing service needs, and life coaching. We do peer socialization and networking. As a huge part of recovery is who you spend your time with. So staff will connect individuals to other peers to build a healthy social network. Staff will introduce peers to other organizations and supports in the community. We provide social opportunities through support groups, focused dialogues, attending local events, service coordination, and recreational activities. We also provide advocacy. Staff will assist in model advocacy for peers to develop empowerment and program solving skills so they can seek resources and services conducive to their recovery. Staff will advocate for individuals through community services, doctor's appointments, legal appointments, etc. The programs that the peers currently have are the Wishing Wellness Center, which is our recovery center. The Wellness Center is open to any adult that's 18 or older seeking peer support for their mental health or co-occurring disorder. We accept walk-ins to complete a self-referral and also accept referrals from our area providers such as Guthrie, FHN, Cortland County Mental Health, and Department of Social Services. We also do an outreach and engagement program where peers will go out into the community and discuss our services and talk about how we can be beneficial to someone who may be struggling. Recently, we've been partnering with the Cortland Free Library and spending a few hours a week there and getting people connected to our services. We help individuals identify barriers and encourage engagement with treatment while having conversations on mental health tools and strategies. And our last program we have is providing peer support at our Riverview apartment building. Support services are provided to a number of tenants as part of their Catholic Charities supported housing program. Peer staff are on site to provide guidance and support as individuals continue to work on their recovery and ability to live independently. Staff can meet with individuals one-on-one as well as having group discussions and group activities. Coming forward in the next few months, I'm hoping to be able to start expanding our engagement times along with increasing activities at the Wellness Center. Lately, we've had some staffing turnover, so we've not been open as much as we'd like to be. I'm also hoping to do more partnering with other local agencies and businesses to expand our services in the community more so where it's needed.
Thank you, Valerie.
Thank you.
Now I'm going to move into a couple of questions that I see in our chat box. Let me just mute people. Okay, so the first question that I see, someone is curious what of these services will be available to / support pregnant or parenting people, including access / ability for children to visit or remain with them during treatment. And I believe this question was asked when we were giving the presentation from Guthrie.
I'm not sure if that question is meant for more of like services being, or when people are accessing treatment services for substance use disorder, or a lot of the programs that I kind of went through in terms of substance use are kind of connecting patients to resources to access once they're discharged, or preventing services. So the hospital doesn't provide like detox or ongoing substance use disorder treatment for patients. And right now, you know, the visitation guidelines. Okay. I would have to probably touch base with kind of the maternity unit and see if they have specific plans around that, because what I've presented doesn't necessarily focus on the maternity patients. I guess those resources are more focused on the ED or the behavioral health unit. So I might have to circle back to some other hospital folks and get back to you on that one.
Thanks, Carly. Another question we had was, can you tell us a little more about what is being done for youth in particular who need behavioral and mental health treatment? For example, will the beds being built at Guthrie help with the bottleneck currently experienced when kids who are hospitalized then have nowhere to go because programs/beds for behavioral health treatment are full?
So the hospital's behavioral health unit is just for adults, and that won't change with the renovations that are happening. The renovations that are happening in the ED would, you know, if they're approved, so we can't make promises about exactly what will be approved, but would create some space for behavioral health patients that's kind of separate from the emergency department, so that it's removed from the intensity of that setting, and provides a more conducive space for de-escalation and space for community resources to potentially come in and meet with the patients while they're in the ED, as it's a safe space for them at that point. So I think that, you know, I'm aware of kind of broader New York State plans, that New York State is planning intensive crisis stabilization centers and then supportive crisis stabilization centers. I think for those, Cortland is part of the central New York region, but so Cortland will have access to those as they kind of get rolled out. I think that the award for the intensive crisis stabilization center has been awarded to Helio Health, and then the RFP is out for the supportive crisis stabilization center. But those are really intended to kind of, I think, address some of these concerns in providing a safe place to access care and be linked to resources in more of a therapeutic environment with peer support and nurses and psychiatric nurse practitioners who are able to provide more of kind of a therapeutic environment outside of the hospital. So I think that there are plans being developed in New York State to kind of address more of that continuum of care. But at this point, the plans with the emergency department are more to make it kind of a better place to de-escalate and a little bit removed from the emergency department and that intensity.
Thanks, Carly. And thanks again, Carly, Hale, and Valerie. We will now hear from agency representatives working in the Community Health Improvement Plan focus area of tobacco prevention. Again, this is just a snapshot of what our partners are doing related to this focus area. There are over 15 partners working on this focus area, so please check out our dashboard for more information. First, we have Nikki Kokabacker. Nikki is a public health educator for the Cortland County Health Department and has a master's degree in teaching, special education, a master's degree in science, criminal justice law, and 20 years experience working in a variety of human service positions. She currently is the lead reality check coordinator for the Tobacco Free Zone program of Cortland, Tompkins, Shenango counties, a grantee of the New York State Department of Health Tobacco Control Program.
Hello, sorry, I was making sure my screen is working. Okay, so we are a part of the tobacco grant that is run through the Cortland County Health Department. And primarily my program involves youth. So I will do a brief kind of overview of what we do, what we've done this past year, and kind of where we're going with the goals identified in the plan. So Reality Check is a youth-led movement. We work with kids ranged from 13 to 18, some 12, but 13 to 18 primarily, to empower teens to become leaders in their communities by exposing what they see as manipulative and deceptive marketing tactics of the tobacco industry. So the first part of that is education and explaining what the marketing is that is kind of hooking these kids, and to produce change, getting them to be outspoken about it with the community, their peers, parents, people who make policy. And then it is kind of their movement. So they're empowered to decide what that really looks like in their community. Why do we do it? I know that Margaret brought up the 2020 to 2021 statistics that we have on youth vaping, and you'll see in 2021, 7th through 10th went skyrocketing from even a year ago. And there's some ideas as to why 11th and 12th didn't as much, but we're having a really big issue with middle school right up until 10th grade with vaping. And I don't see that going down just right now. We're really seeing a lot of it. This is some more of the health disparity information based on these youth. So even within the subset, there's intersectionality. So prime targeting for marketing is, age 13 and up. We know that, but we also know that people who are LGBTQ, people who are in vulnerable populations, people who are transgender, they are having higher percentages. So the intersectionality is they're also 13 and coming out with these identities. And then on top of that, they're being targeted for their age. So there's a lot of intersectionality between the disparities. And even the risk has gone up since last time. So how do we do it? What are we focusing on? We're focusing on the ways that they get to these youth. How are they reaching the youth? And it used to just be a big, most of the time you'd see it in gas stations. Well, the reality is it's changed. So movies are a prime example. A lot of kids are exposed to tobacco use in movies for absolutely no point to the plot. It's, people are paying these movies and Netflix and things like that to put smoking in their movies to get to these kids. So we're working on that, and that's a national initiative. We're working on locally on what they see retail wise. So not just gas stations, but now we have vape shops. Now we have all these other places that make it look fun, and they have the LED lights, and they're really engaging with these kids. And that's partly why you're seeing vaping a bigger issue with that age group than cigarette smoking, is it looks more fun. These things look like video games. They look like USBs. They're just, flavored. They're not really targeting adults nearly as much as they are targeting our youth. So where we live, work, learn, and play, we're working in parks, in, your downtown spaces, places that the youth hang out, to really educate adults as to the marketing, because it's easy to not see what's going on until you have, a ton of kids in the middle school getting caught with vapes. So we're trying to get the kids involved in the education as well. So what did we do in the last year? We are working in Disparity project, as well as working in our youth age group. So we are focusing on the use, not just in the 7th and 12th grades, but in the LGBTQ population within our communities, in that age group, and adults. We meet with our assemblymen and our senators, and we discuss these issues and how, you know, the vape shops are still to some extent selling things they're not supposed to, and how they are marketing towards youth. We go to schools and we do presentations, and sometimes we have, you know, youth that come up and they want information on cessation and how to quit, or how to get a family member to quit, or they want to join and be a part of the youth movement. Currently, we have a Homer Middle School group that meets weekly when school is in session, and we are starting a high school group this year as well. They have done radio PSAs, they've done local media. They will table and educate their peers at lunchtime on the different truths and statistics about the marketing. We celebrate little, we don't call them holidays, but little event days. We will do different projects based on World No Tobacco Day, Great American Smokeout, smoke-free movies. Let's see. And we attended the Youth Summit, which they haven't had since 2019. So it was very exciting. They did 4 days of trainings, presentation, an activism fair. And what's next? This year is pretty busy already. Homer High School, like I said, we're starting a new group there. We just completed a mobile selfie art installation with Crystal Lion. It is being unveiled on Friday at the Mural Festival. Youth are hopefully going to get to meet with legislators and other policymakers in person this year, or by Zoom if not. They may also have the opportunity to travel to Richmond, Virginia to take part in Mobilize Against Tobacco Lies, which allows them to take part in activism, but also to be a part of the stockholder meetings and listen to Big Tobacco talk about kind of their marketing plans and ask them some questions. Their voice is going to be heard. That is our number one goal. And of course, Youth Summit 2023. So I will play it's brief, but I wanted to play a video of this year's Youth Summit with some of our youth and all the youth from New York State that participated. And of course, I don't know if you can see it. So hold on, I'm going to reshare and then it should work. There we go.
Nikki, is there supposed to be sound with the video?
Yes, hold on. I'm not sure why that's not working. Don't know if that helps. I don't know why that isn't working. Well, we can skip that. I can put that, it'll be in, if a PowerPoint, if we send that out, I can send out that link. Are you able to hear me?
Yes.
Okay, sorry. So it's on YouTube. I can send that link out when they send out the email. It's like a 5-minute video just of everything they did. These photos also, I don't know if you can see the photos now. Let me start that up again. Hold on. There's always something with the video. Here we go. So this photo here was all the youth across the state and all of the staff. So there was a large amount of people. We took over a college for the 4 days, and they really got invested in the different kinds of activism, as well as the different kinds of leadership opportunities across state, even after they hit 18 and go to college. So it's our youth empowerment model for this year is hopefully going to be even better because we're able to do more things in person. But thank you.
Thank you, Nikki. Next, we have Danielle O'Brien. Danielle is the coordinator for the CNY Regional Center for Tobacco Health Systems at St. Joseph's Health. Danielle has worked at St. Joseph's Health for 14 years, and all of her experience has been in mental health. She has her bachelor's degree in psychology, English from SUNY Oswego, and is pursuing her master's degree in management at Cayuga College.
Hi. Hopefully you can see my screen.
We can see your screen.
Okay, good. So thank you for the introduction, Hannah. I am from the CNY Regional Center for Tobacco Health Systems at St. Joseph's Health, which is located in Syracuse. However, we do obviously work with Cortland County as one of our 10 counties in our catchment area. So I have a little map here. We're kind of this little middle slice of the state of New York, I would say. So we are one of several grantees. All of the grantees cover 62 counties in New York State. And our goal is to work with healthcare systems to improve the reach and delivery of evidence-based tobacco dependence treatment to all New Yorkers who use tobacco products. So Broome, Shenango, Cortland, Jefferson, Lewis, Madison, Oneida, Onondaga, Oswego, and Tioga County. So where Nikki just presented, we work closely with her. Her focus is on youth. Our focus is really working with providers to be able to educate the tobacco users that they serve. So I guess kind of a fancy way to say it is we facilitate health systems change with community health centers, federally qualified health centers, behavioral health care organizations, community-based organizations with a focus on agencies that serve populations disproportionately affected by tobacco use and dependence. Some of these populations include individuals with frequent mental distress. Doesn't necessarily have to be a mental health disorder, but just, you know, could certainly include that, or just somebody that's in frequent mental distress, because typically a lot of people that are stressed out about something tend to smoke more or initiate smoking. Those enrolled in Medicaid, those living with income less than $25,000 annually, those that are housing vulnerable, so not necessarily homeless, but maybe just don't have a safe and secure place to stay, and those with a low education level. I won't go through this entire slide, but I did just want to point out that our focus area specifically from when Margaret presented was preventing tobacco use, and the goal that we are focusing on here at St. Joseph's Health is promoting tobacco use cessation. I just kind of pulled from the actual breakdown of all of the interventions, what specifically we are doing, but like I said, I won't go through it, but I would highly suggest you all go take a look at it if you haven't already. We will get into what we do, and it won't be all convoluted on that slide. So we use the clinical practice guidelines. That's kind of the best practice out there. That's been developed by the United States Department of Health and Human Services. That's what all of the grantees use, because really that's, you know, the best that we can find of evidence-based methods and treatments that help tobacco users quit and stay quit. These are some of the things that we discussed when we first become really engaged with one of our partners. So let's say, you know, we reach out to Guthrie and we haven't talked to them before. They're one of our partners that we want to, you know, connect with and provide our services to. And this is just a slide that shows what our staff can really help with and how they do that. So really, I would say not the most important part, but a huge part of what we do is making sure that there are staff at a facility that can engage in tobacco cessation efforts. It doesn't necessarily have to be a primary care provider or a psychiatrist. It could be a counselor who does groups. It could be a nurse practitioner, a respiratory therapist. It could be a lot of different things. It doesn't have to be one specific role. And really providing tools that those service providers can use to evaluate ideally every patient for tobacco use. So the true goal is to get some sort of electronic screening system in place. Not every, believe it or not every target partner that we talk to uses an electronic health record. Some still use paper for things, or different departments use paper. So one of our main goals is to really make sure that even if it is on paper, every patient, every time is evaluated for tobacco use. From that, really the goal is to provide some sort of referral and follow-up so they can get treatment. A referral can be, you know, something as easy as referring them to the New York State Smokers Quit line, which is a wonderful resource in our state. It could refer them to a smoking cessation group or smoking cessation materials, things like that. So that's kind of what we provide as a summary to those newer partners that we first communicate with. Our overall goals, in a nutshell, are to reduce tobacco use among adults with low incomes, low educational attainment, and serious mental illness. Focusing on system and policy level improvements to implement systems to screen patients for tobacco use and provide tobacco dependence education to staff at our agencies, and to provide evidence-based referral systems to ensure that New York State tobacco users have access to effective tobacco cessation treatments. Other things we can provide, if partners are willing to kind of listen to what we're saying and want to hop on board and work with us. Technical assistance with those best practices that we talked about. Educational resources. One of the things I did at the end of April was I just sent a big, I called it a welcome package. It was about 10 pounds. And it had a bunch of materials about thinking about quitting, ready to quit, cost of smoking calculators, New York State Smokers Quit line, quit cards. It had a bunch of materials in it. And I really just sent one out to all of our partners that we, even if we haven't spoken to them, those identified that we do want to partner with. That was, you know, to no cost to any of these partners. I just wanted to get the information out. We can provide policy templates. So if I'll keep using Guthrie as an example, just because they're on the call. If Guthrie wanted to put something in place that they didn't already have, and let's say, you know, they wanted all of their physicians throughout the hospital, every physician that talks to a patient when they do an initial intake or an initial meeting to address tobacco use, and they want to put something into hospital policy, we could help with that. Most places have, you know, somebody that does that, but not all of the partners that we work with do. Training curriculums, so we can train staff. We can provide curriculums for staff to do groups if that's something that they choose to do, which we have had that recently. We've had one of our mental health partners is starting a tobacco cessation group actually in 2 weeks. They've never done it before, and we provided the training curriculum so they have an 8-week program and they feel confident, and you know, we're just kind of there for assistance if they need any help with anything. Those printed materials, we typically send out our monthly newsletter right at the end of each month, but also sporadically, sometimes with newsletter and sometimes separately. We will send, any sort of latest news or research in the world of tobacco. If there's something that's really earth-shattering, like the menthol ban, that the information that came out a couple of months ago, we would send that to our partners and just make sure that everybody's aware. And I just wanted to shout out our Cortland County partners. These are partners that we either currently work with or have worked with in the past. COVID certainly didn't help things. It put our program on pause for almost 2 years. So we lost a lot of our former contacts that we had worked with. We are slowly rebuilding that contact list, but we have really great partners out in Cortland County. So shout out to everybody here. And this is our contact information. Our program director, me, the coordinator, and then our two program specialists who are what I would call certainly experts in the field. They have been doing work in tobacco for many, many years, and their knowledge is pretty much endless. So you could really honestly email any of us if you were interested in wanting to be part of our monthly newsletter, or anything you wanted to ask. Certainly you could reach out to anybody. And that's.
Thank you, Danielle. With no questions in the chat, I'm going to move along. We will now hear from agency representatives working in the Community Health Improvement Plan focus areas of COVID-19 and flu vaccination. Again, please take a look at our dashboard to see all the work public health, healthcare, and other community partners are doing related to this focus area. First, we have Suzanne Osterhout. Suzanne is the supervising public health nurse at the Cortland County Health Department. She has been with the county for 22 years and works in several public health nursing programs, including immunizations. She has assisted in the coordination of many immunization outreach activities and leads the Cortland County Immunization Coalition.
Thank you, Hannah. So my focus area is vaccine preventable disease, with the goals of improving COVID and flu vaccination rates, and also reducing disparities in those same vaccines, COVID and flu. And the first strategy that I'd like to just highlight is the social media marketing campaign that we launched early in 2022. And that, to back up just a little, after when we were looking at vaccination, COVID and flu vaccination rates, we identified two groups with the greatest disparity in vaccination. And those two areas, one being the adults living in rural areas of our county, and Margaret did speak to that earlier in the presentation. And then the other group would be the Cortland County residents ages 18 through 25. Those are the two areas that we found the greatest disparity. So taking that information, we surveyed providers through our Cortland County Immunization Coalition, and to determine what they felt were the most common reasons why the vaccine, flu and COVID uptake was not as great in those areas. And so based on that survey, we worked with CACTC in developing messaging. And the messages that we developed promoted vaccination through social norming, encouragement to discuss concerns with the COVID-19 vaccinations with their healthcare providers, and overall combating COVID-19 vaccine misinformation. The exciting part of this strategy also was how we were going to push out those messages. And one area that we are using is two social media platforms, one being Facebook and the other being Snapchat. And we are able to, target these two groups with our messaging. The other two areas that we also pushed out our messaging would be in media print and also radio. And interestingly, we found that flu vaccine, from the survey, flu has very similar reasons. And so we're actually going to take what we've done with COVID-19 and move it into flu vaccination. And actually that messaging will start to be pushed out this week. So another area that we are, another strategy that we're going to implement is employing, or not employing, but looking to vaccine ambassadors. And these would be people in the community who would be trained to empower community members in their social networks empower them with stories of positive experiences with the immunizations. We will plan to recruit and train specifically in our rural areas to identify those vaccine ambassadors. And those vaccine ambassadors can include the first responders, people from businesses, faith-based organizations. It doesn't necessarily have to be somebody in the healthcare provider field. We also are going to work with ATI, or Access to Independence, on their vaccine ambassador initiative for people with disabilities. And also we will take the vaccine ambassadors and work with them through our Immunization Coalition, which brings me right into the next, getting involved. The Cortland County Immunization Coalition has been around for a very long time, and the goal has always been to increase vaccination rates. But with this goal in mind of focusing on COVID and flu, we have worked with our coalition on implementing our social media vaccination campaign. And also we hope to, like I said, pull in those vaccine ambassadors as well. In the past, our vaccine coalition has been made up mostly of healthcare providers, but we are looking to expand that to other community agencies. And those interested in raising vaccination rates. So if you are looking to get involved, you're certainly, Margaret has my email address right there, and you're certainly welcome to reach out and express your interest. We meet once a quarter, mostly virtual now, and it's a great group and a great area to get our messaging out. And that's it. We do have other areas, but those are our main focus right now. Thank you, Hannah.
Thank you so much, Suzanne. We now have Catherine Wild. Catherine is a project coordinator at Seven Valleys Health Coalition, who oversees its transportation to employment and supports for health programs.
Sorry about that. I think I froze for a minute. Can you hear me now?
Yes.
Okay, thank you. So some of you might already be familiar with some of Seven Valleys Health Coalition's other subsidized transportation programs like Supports for Health. I'm going to be focusing a little bit on our newest program, which aligns with the vaccine preventable disease intervention. And that is in partnership with Access to Independence. We are aiming to increase access to COVID-19 vaccines for individuals who self-identify with having a disability. And this program really came about due to the success of and demand for our previous programs, such as Supports for Health. In this area where transportation is such a challenge for people in rural communities, there's just such a need for additional transportation options out there. So Supports for Health is the program that if you need to go get a prescription or get your groceries or get benefits renewed, we can provide temporary transportation assistance to those types of things. And as a result of the demand for that program, we also decided to create a transportation to employment program. And as you can see, those two programs were both very successful in the second quarter. And so the demand for those programs led us to partner with Access to Independence, which got funds through the Centers for Disease Control and Prevention to provide this transportation. So until the end of the year, we're going to be able to give subsidized rides to individuals who identify with having a disability to get their COVID-19 vaccines. Basically, the idea is that individuals with disabilities are dying at a higher rate from COVID-19 than people without disabilities. So we really want to remove any types of barriers to care. So if transportation is a barrier, we want to help you overcome it. And we can do that in a number of ways. We can lean on our existing partnerships with cab companies in the area. We already have a lot of partnerships with those. Pictured here is Access to Independence's van. That's for accessible rides. If you have a wheelchair, you need to get transportation, you can use ATI. We also, CAPCO's volunteer driver program currently has a couple of drivers, so we use them whenever possible. And gas cards are a really commonly used support. That was a very popular one across all our programs, so we anticipate continuing to use those as well. And again, the idea is also bus passes and tokens are mentioned here as well. We can use that, and I can also try to help work with people one-on-one to try to identify the most sustainable strategy moving forward. That's a big part of it, like helping people figure out, okay, I can get a ride to this, but long-term, what is going to be my best option moving forward? So I've already done that through the Transportation to Employment Program and Supports for Health. So we're going to continue to do that with this program. And really the idea is to remove those barriers. If transportation is a barrier, we want to help you overcome it. And I think that it will be successful like the other programs. So, and again, we're not going to ask you like to divulge a disability or ask for any proof of it. It's really, if you self-identify with any disability, we can provide that. And people can self-refer, they can get referred to agencies. Referrals can come in a number of forms. So that's all.
Thank you, Catherine. There are no more questions, so that wraps up tonight's presentation. Thank you all again for coming. In the next couple of days, we will send out the recording and answers to questions we were not able to get to tonight. Have a great evening, everyone.